Hello everyone, my name is Dr. Paul Richardson and I'm the Clinical Program Leader and Director of Clinical Research at the Jerome Lipper Multiple Myeloma Center at Dana-Farber Cancer Institute in Boston, Massachusetts. And it's my pleasure to be here at IMS and to be talking to HealthTree about the various advances that we're discussing at the meeting, that it's been my privilege to be part of actually the presentations and discuss them with colleagues at this fantastic meeting in Toronto, Canada. I think the first one I wanted to really touch on was our presentation as a major session on the evolving landscape in first relapse for our myeloma patients, and importantly, the recent approvals outside of the United States of belantamab-based, both in Europe and elsewhere, for the use in combination with either bortezomib or pomalidomide for patients who are relapsing after initial treatment. And we sought in this discussion to really frame for our audience the needs in early relapse and to emphasize that now that patients are getting quadruplet therapy up front, it becomes very important what we choose in first relapse to really improve second remission outcomes and extend them for as long as we can. And obviously the belantamab data have been particularly encouraging in that regard, with the combination of belantamab and bortezomib in itself resulting in gains of up to 3.5 years of progression-free survival as well as survival benefit for our patients, and belantamab combined with pomalidomide and dexamethasone doing something very similar. So with all of that in mind, we then framed that in against, or not against so much, but in comparison with cilta-cel, which obviously had dramatic results with the so-called CARTITUDE-4 study. Now those results were nothing short of miraculous, but it was very important to understand the differences and important to also understand the gains in progression-free survival were actually very similar. And I think that was very important for our audience to understand, and then to be able to appreciate the differences in tolerability, access, and the potential for serious complications, recognizing that fortunately in the setting of CARTITUDE-4 these appeared to be relatively rare. All that being said, I think it was very important for the audience to appreciate that in the real world of practice, it's key for us to have new mechanisms of action available to patients of all different varieties. So antibody drug conjugates seem to be very important in that regard, with belantamab-based combined with bortezomib or combined with pomalidomide really looking very promising. And in the same token, obviously the CAR-T platform providing hope for those patients for whom it's appropriate, recognizing that it's a very specialist approach and that we must, of course, be super vigilant about the potential for very serious side effects. All that being the case, the overwhelming message was a very positive one, that we have new options for our patients that are much needed, and in the setting of the successive quadruplet therapies with now highly successful or highly promising approaches at relapse, the outcomes for our patients over the longer term increasingly look more favorable.